Hello and welcome to our webinar series, Candid Conversations on Health. Throughout the year, we will tackle a variety of topics related to our health and wellness. The focus of today's webinar is minority health. This webinar is being done in collaboration between LDH's Bureau of Community Partnerships and Health Equity and the Bureau of Minority Health Access. April is National Minority Health Month. So we are raising awareness about health disparities that continue to affect racial and ethnic minorities. In alignment with the Health and Human Services Office of Minority Health, the main theme of this webinar is Give Your Community a Boost. This theme focuses on the continued importance of COVID-19 vaccination, including the booster, as one of the strongest tools we can use to protect ourselves and our communities from the COVID-19 virus, which has disproportionately affected communities of color. CDC data shows that particularly Black, African American, Hispanic, Latinx, and American Indian and Alaskan Native people are at an increased risk of getting sick and having more severe illness and dying from COVID-19. My name is Ayana Usri, and I am the support coordinator for the Louisiana Department of Health's Bureau of Community Partnerships and Health Equity. The Bureau of Community Partnerships and Health Equity is devoted to increasing the citizens of Louisiana's knowledge about what affects our health, especially for those in particularly vulnerable communities and populations. This devotion is rooted in raising awareness through webinars like today's and partnering with stakeholders in the community to move toward a healthier Louisiana. At this time, it is my honor to introduce Mr. Mark Thomas, Deputy Secretary of the Louisiana Department of Health, who will share a few welcoming words. Mr. Thomas.
Thank you, Ayana. On behalf of our Secretary, Dr. Courtney Phillips, I would like to say welcome and thank you for joining us for this relevant conversation. National Minority Health Month is observed every April to underscore the importance of improving health outcomes for racial and ethnic minority groups. As part of National Minority Health Month, we also highlight the importance of reducing health disparities, which are preventable differences in opportunities to achieve optimal health for people who are disadvantaged by their social or economic status, geographic location, or environment. This year's theme of National Minority Health Month, Give Your Community a Boost, focuses on the continued importance of COVID-19 vaccination, including COVID-19 boosters, and sharing credible information as important tools to end the COVID-19 pandemic that has disproportionately affected communities of colors. In this presentation today, these folks will discuss the importance of remaining vigilant against COVID-19, vaccine safety and confidence, ways to protect against COVID-19 as we get back to the new normal, and they will discuss various efforts that has been employed related to Minority Health Month and COVID vaccine testing. Once again, thank you for joining us for this very important discussion. Ayana.
Thank you, Deputy Secretary Thomas. Now I'll provide a brief outline of today's event, as well as introduce our facts about COVID-19. All right, so here is our schedule for the event today. We're going to start with our intro and welcome, then we'll go over our facts, we'll have our panel discussion, and then we'll discuss those key takeaways. The objective of this webinar is to increase awareness of the ongoing COVID-19 pandemic and its effect on communities of color, as well as the importance of vaccination. It's information. Get up-to-date and accurate information from credible sources related to COVID-19. Vaccination. LDH and CDC recommend that everyone in Louisiana 5 and older is eligible to get vaccinated against COVID-19. Prevention means masking up, especially in enclosed and crowded spaces, social distancing when able to, and washing our hands thoroughly, because these can protect us from the COVID-19 virus. And last but not least, COVID-19 vaccines are safe and effective. These 4 facts, information, vaccination, prevention, and COVID-19 vaccines are safe and effective, are ones that you will hear throughout the webinar. I want to stress the importance of getting information from trustworthy sources so that if you're going to share COVID-19 information with loved ones or within your communities, please only use information coming from websites like the Louisiana Department of Health, the CDC, and the like. We will provide you with a one-pager via email after this session to aid you in how to share this kind of information. Sharing accurate information can help save lives. And now it is my pleasure to introduce the Director of the Bureau of Community Partnerships and Health Equity, Devonja Brown.
Thank you, Ms. Ussery. And thank you all for joining our Candid Conversation on Health, National Minority Health Month webinar. Before I turn the session over to our event moderator, here's some helpful information for people with Medicaid insurance. If your medical insurance coverage is from Medicaid, then you must make sure that your information is up to date. This includes your address. If you do not update your information, you may miss important letters from Medicaid and you could lose your health insurance coverage. To update your information, you can visit the self-service portal at www.ldh.la.gov/my-Medicaid, or you can call 1-888-342-6207. Now, on to tonight's event. Our hope is that today's discussion is both informative and helpful. Without further ado, I'd like to introduce our moderator, Ms. Gerrelda Davis. Ms. Davis received her Bachelor of Arts degree in English Literature from Louisiana State University and her master's degree in business administration with a concentration in healthcare management from the University of Phoenix. She worked for Louisiana state government for 22 years, serving in numerous positions where she worked to identify and pursue opportunities for increased access and funding for primary care and rural health initiatives. Currently, she serves as the executive director of the Louisiana Primary Care Association, which promotes healthcare access for all and elimination of health disparities, while ensuring that community health centers remain viable providers of primary health care throughout the state and resolute partners in comprehensive healthcare delivery systems. With that, let's start our conversation. The floor is yours, Ms. Davis. Ms. Davis, you're on mute.
Thank you. So sorry. So thank you. Thank you, Deputy Secretary Thomas, Mrs. Brown, and Ms. Ussery for starting today's event. For each of you, community members and stakeholders who took the time out of your very busy schedules to attend this important discussion, thank you. In this webinar, our hope is that what you hear, you find useful, empowering, and encouraging. We want you, the audience, to leave this conversation empowered with the knowledge to know the signs, symptoms, and risk factors of COVID-19, as well as what people should do to be tested for COVID-19 and what vaccination options may be available. We have trusted gatekeepers from around the state who will lead and be a part of this discussion. Before we go any further, let me do a brief introduction of our wonderful panelists. Dr. Eric Griggs, also known as Doc Griggs, is a community medicine and health educator based in New Orleans. Since graduation from Tulane University School of Medicine, Doc Griggs has been an active health advocate and has made it his life's work to educate his community on health and well-being. Dr. Griggs currently works for Access Health Louisiana as the Director of Community Medicine and serves as the Community Medicine Advisor for Xavier University School of Pharmacy, Health and Wellness Center. Elwyn Chief Warhorse Gilliam was born and raised in the village of Bonfouca, Louisiana, and still lives there with her husband of 47 years. She's a mother and grandmother, civil and human rights advocate, former motivational speaker, and educator on health issues and community preparedness. She helped bring observance of Martin Luther King Jr. Day to St. Tammany Parish in the 1980s and developed the parish's first majority voting district in 1991. Her family's 365 elders appointed her to serve as chief of the Chifuncta Nation, Chata tribe in 1998. Following Hurricane Katrina, Chief Warhorse developed and founded the Community Preparedness Response Network, CPRN, to bring together agencies and resources for grassroots communities to prepare and respond to emergency situations. The historically underserved community partnered with them to preserve and develop their traditional agricultural practices. Chief Warhorse has been recognized for her work to increase community representation in the 1980, 1990, 2000, 2010, and 2020 US Census. By the Louisiana Department of Health's Bureau of Minority Affairs for engaging hard to reach communities through the CPRN, and FEMA's Mississippi Recovery Office for her contributions to Native American cultural heritage. She has spoken at universities and to organizations around the country, and her radio show, Cooking with Chief and Serving Up History, has been heard around the world. Dr. Gary Wiltz is the Chief Executive Officer of Tesch Action Clinics, a network of 16 federally qualified community health centers located in 7 parishes in Southwest Louisiana, with the main site in Franklin, Louisiana. As a graduate of Tulane Medical School and board certified internist, he began his medical career at TAC in 1982 as the medical director. Dr. Wiltz initially intended to fulfill his 3-year obligation to the National Health Service Corps in Franklin and return to his hometown of New Orleans to take a fellowship in the subspecialty of nephrology at Tulane Medical School. However, he soon realized that this clinic and this work of serving the underserved was his divine calling. With this affirmation, he fully committed himself to TAC, and over the course of the next 38 years has helped to build what has been acknowledged as one of the nation's premier FQHCs. TAC serves over 25,000 patients at 16 sites, and its mobile unit has approximately 250 employees and an operating budget of $22 million. While the growth and success of TAC is often attributed to Dr. Wiltz, he often reminds the community that TAC's growth and success is attributed to the board of directors and TAC employees' support for the mission and vision of TAC, its patient-centered approach to care and community engagement. Pablo Estrada Vasquez is a native from Guatemala and is the current president of Asociación Cultural Latino Acadiana, ACLA, a culturally based nonprofit out of Lafayette, Louisiana. Estrada's focus has shifted the direction of ACLA, taking it back to its mission to serve the community while providing proper representation for Latinos and Latinx in Louisiana. Estrada studied business management at Universidad Galileo and later went on to study criminal justice while working in law enforcement. Estrada believes in fostering a neutral ground where different cultures can learn from each other through involvement and respect. ACLA has been instrumental in Region 4 to build needed trust, creating the acceptance of health and community programs while delivering important information in Spanish directed by Estrada. These are our esteemed panelists. They are going to help us have a brief but deeper discussion. As we start this panel discussion, it is important that we continue to remain vigilant in the fight against COVID-19 and pursuing a healthier Louisiana. This discussion will be factual, based in science and understanding. Let me be the first to say, as the moderator of this session, that people have a right to feel what they feel regarding their past and present experiences of racism, sexism, mistreatment, or injustice. We know these experiences play a part in people, populations, and communities' trust in the healthcare system. So let's get this panel started. My first question is going to go to Dr. Griggs. And the first question is for all of the panelists. What is your profession and how is it related to minority health? Dr. Griggs.
So first of all, good afternoon / evening. Thank you for asking me to join such an esteemed panel to talk about something as serious as we're talking minority health. My current job title is Community Medicine Director at Access Health Louisiana. I have a lot of titles, the most meaningful of which is my doctorate. I say that because I happen to be the health educator for the local Fox affiliate, Fox 8 News. And it's interesting, my fans, I'll say, or my viewers, it's about 1 million a day, they come in all hues and colors. But I find it most interesting when I walk in the minority communities and they just come up. You know, it means a lot. Growing up with my grandmother, when you go to church and you know you're doing something right, when the older people in the community, they say, "Thank you, baby. Keep doing what you're doing. We're proud of you." So that being a face in the community of someone that shows what can happen and the difference you can make as minorities in this fight against really inequity in all healthcare. The current fight, and I've been most visible in the fight against COVID, but that's been my job. 18 hours a day, 7 days a week for the last 2+ years, because Dr. Wiltz will attest, we did a lot of reading in med school, but I think in the last 3 years, I feel like I've done residency, med school, a fellowship, you name it, I've done it and I've read it, and it just makes me proud to be a part. Hopefully I can be a role model for some of the kids looking up.
Thank you. Mr. Estrada, what is your profession and how is it related to minority health?
So I'm actually a volunteer president of ACLA. I do not get paid to do what I do. So again, I pretty much just enjoy having the ability to create change, like Dr. Griggs just say, simply the ability to create that bridge of trust, because it's much needed. I see it within my demographics, my community, Latinos in the area. Most of the time, they simply do not understand, and there's not a face that is able to take them from A to B or from A to Z while explaining in a way or a process that is easier to be comprehended. So again, obviously, I do have a regular job, but my job does not do anything with COVID. That's simply my passion now with ACLA, being the president of the organization and being able to take us back to its roots, to be able to serve the community without really having a financial need per se. So again, it's a little bit different, the mechanics of how we do things. But it's definitely interesting. It's been great to be able to learn, because I was literally just gifted into saying, "Hey, you're the new president. Good luck." So again, it's been great. It's been an amazing experience just to be able to experience what COVID was to all of us as community, and then not only deal with COVID is here, but how can I create a change for my community during COVID?
Thank you so very much. Dr. Gary Wiltz, what is your profession and how is it related to minority health?
Well, first of all, I want to thank LDH and all those who were responsible for putting this on. And candid conversation, I think, is what we want to have and need to have. By profession, I'm a doctor of medicine, internist, board certified to be specific, but I consider myself more of a public servant and healer. I hail from, I was on a panel, I guess about a month ago, where I was asked to share my experiences of training at Charity Hospital in New Orleans, the big charity, as we called it. I think I was the only one on the panel that had the honor of being born at Charity Hospital in New Orleans and training in that institution. And that training and that experience, I think, shaped my philosophy and mission. And realizing that you really have to look at the etiology and the root causes of the social determinants. So I don't have a degree in social work or in public health, but as I've done this for close to 40 years now, I realize that we really have to go upstream. And I've committed myself completely to working against disparities and improving equity. More recently, with Ms. Brown, I served on the governor's Health Equity Task Force, as Dr. Griggs has also, and That is what my heart and soul is. I believe in population parity. So I think that we should be reflective in society as we are in population, particularly in the African-American community. If we're 12 to 13% of the population, then you would think our numbers would be reflective of that, but the disparities that we encountered do not bear that out. So committed to making the playing field level. And my motto is no one can help save us from us but us. So giving people the right information in a way that they understand to take charge. And I always start every new visit with a prayer of serenity. So I challenge people to change what they can change. And then, the policymakers and the things that we do to try to make the policies right to create a win-win situation. So that's my commitment.
Thank you so very much. And I would be remiss. I know we've noticed that Chief Warhorse is not here. We definitely missed her. She was not able to be with us, but if she is able to join us at any point, we will make sure that she joins our panel. But I definitely would like to say that we have an excellent panel of experts, and we are going to continue with our questions. I'd like to ask Mr. Estrada. So Mr. Estrada, and I heard your history, and I love the fact that you are a volunteer because you find this very important for your community and our communities as a whole. What information is required, or better yet, what are the pressing needs of minority communities as COVID-19 devastates these communities? What have you seen to be the pressing need in your communities that you are serving?
So obviously, we know, again, the importance of vaccination. And unfortunately, there was not much of a vaccination buy-in from the get-go. And again, the unfortunate misinformation that continues to happen, it takes place everywhere. So, from the rumor that a neighbor told you to what your best friend told you to, again, it continues to spread out. And unfortunately, we don't have, in my opinion, and again, I'm not speaking science because I don't possess a degree like our panel doctors. But again, what I have been able to see is the misinformation continues to be a huge way to not have a buy-in. So, and again, just to speak from my experience, I literally had to create informational videos in Spanish while getting the vaccine so that people could find that, well, if he did it, maybe it's okay. Here's my personal number. You're able to reach out to me. I'm going to answer the number or the phone for you, and I'm going to try to answer all of those questions that you might have. And that in itself created, I want to say our number right now for ACLA is like 2,800 people that were vaccinated through our events. Again, not a huge number if we think about population in the state of Louisiana, but if we think about the demographics and the area that I'm in, 2,800 people that were vaccinated simply because we went out there and said, hey, I'm here. How can I create you comfortable enough to allow us to provide this free care, which is, again, to them, it was crazy to even think about the fact that there is no cost associated with it. But again, we go back to the misinformation, them thinking that you have to have this medical insurance. You have to have all of these things that are not necessarily required, but there was also not the correct information put out from the get-go.
Thank you so very much. And it's always, always important to have a community champion. And I hear that in you and your organization. And it's also very important to ensure that the information that's out there is true information, science-based, as it was said earlier. So Dr. Griggs, what is a booster shot for this vaccine, and why should individuals consider getting a booster if they already received their initial shot of the vaccine? And I'm going to add a little bit more to that, Dr. Griggs. I see you looking. So now they're talking about a fourth shot. So why should individuals, what is the booster shot or vaccine, and why should they consider getting it?
So since this is a candid conversation, I'll say, like I said on TV to a million people over and over, bring the smoke. I want the smoke. I like the smoke. I love the questions that you can't make them too difficult. The booster shot is exactly that. We tend to treat it as something that's foreign, but it's not. We've taken vaccinations all our lives. We'll take them at certain ages, starting as a kid. So if we have a child, we know that we need to go back in a month, then 3 months, then 2 years. A booster shot, what it does is just re-ups your protection should you encounter whatever pathogen or virus that might be out there. We know the one that we're most familiar with, and we don't call it in the community, they don't call it a vaccination at all. They call it the flu shot. And now, if we talk to my mom, because of her experience with boosters, and I don't think my mom likes needles, but she said, I don't want to get another booster, rooster, turkey, or hen. It is not food. It is nothing foreign. It's exactly that. It's something that is protective to us. And in the event that our antibody response or our immune system response should wane. One thing that we've done throughout the pandemic is we've simplified this very complex thing called the immune system. A lot of the responses now, a lot of people tell me that they didn't know that fever, all of the things, the inflammation, it's all part of things trying to protect us. So what a booster shot is, it's really re-upping your team and making sure that your body can be protected from whatever new iteration of variant or virus that might be out there. Now, with regards to the fourth shot, I think that every time that if you are immune compromised, particularly, you should talk to your healthcare provider and do your due diligence to ask your community champions, if you don't have access to your brilliant doctors like Dr. Wiltz that are your healthcare providers, or Pablo Estrada in your community, to break it down so you can understand, to go through the weeds of it, to just to distinguish between the mis and disinformation. Es correcto, Pablo?
Thank you so very much. And Dr. Gary Wiltz, so Dr. Griggs mentioned this. Which variants of the virus are we currently at war with? How is it different from other variants?
Well, let me see what time is it. It's 5:30, so we probably had 3 more variants as we speak. I think people get lost in the alphabet soup of the variants. We have the BA, BA1, BA12121. So I think the bottom line is you have to practice universal precautions. And to just reemphasize what has been said earlier, the best protection is vaccination. Before we started the panel, Dr. Griggs and Mr. Thomas, we were talking about that. There are very few times in medicine where we have something that has proven to be so effective to prevent death, hospitalization. And going back to what Pablo was saying earlier, the distrust and misinformation. I don't know if you'll remember, particularly in the African-American community, in the beginning, they were saying, well, Black folks don't get this virus. That was wrong. If I had the little beep sign, I go, no, that's false. And we were the perfect storm, particularly in Louisiana, where we ranked number 50 in the United Healthcare Foundation. All the risk factors, our population had obesity, diabetes, hypertension, as pre-existing conditions. And when this virus hit, it was like a Darwinian process, survival of the fittest. So a lot of our folks, unfortunately, weren't in the best state of health. We were getting there. I think with Medicaid expansion, a lot of our folks were getting access and we were moving the needle, if you will. But the virus exposed that disparity. And for that reason, I think that set us up. But misinformation actually cost us a lot in the early phases. People were not getting tested, and then the hesitancy that people were experiencing getting the vaccine. I put this up all the time. You can see that on that. See this young lady here? That's Dr. Kizzy Corbett, who Dr. Fauci gave credit for with developing the mRNA vaccines. And when I walk in the exam room, particularly with African-American folks, I always show them this picture. This ain't Tuskegee. This is an African-American woman who worked on this for 7 years. So right off the bat, I think we misstepped by not acknowledging that this wasn't new, that was pulled out of the air. The work had been going on for years and had been tested. We do clinical trials, as you all know. And I think the misnomer of Eric, they named it warp speed. In the Black community, when something's warped, it means it's all it's all bent and out of shape. And so I think the connotation that people got the impression this was rushed, and it wasn't. So acknowledging people's fear, but then giving them factual information is paramount in that trust, both in the faith-based community and medical community and community like Pablo is involved in. You know, when folks see that people they trust or are taking the vaccine and doing those things, then I think that helped us a long way. But in my next round, I'll go over the vaccine sequence and what's recommended to give that factual information. Okay.
Thank you so very much. And I, you know, as one who's been working in healthcare for over 20 something years, I can tell you that when it was first talked about the vaccine, I too was hesitant. Of course, I thought of the Tuskegee experiment, but then I started thinking about all of the things that could go wrong. But I appreciate the fact that I work with such esteemed doctors and providers who gave me the information I needed to definitely make an informed decision, a science-based decision. So I thank you all. And I also appreciate the community champions. And I'm so glad that Chief Warhorse has joined us. And so I know she also is a community champion. And I'm going to ask you the next question, Chief. I want to know, because I know, you know, and Mr. Estrada talked about the communities he's working in and the fact that they actually had individuals over 2,000 vaccinations because of the work that they're doing. So my question to you, Chief, is in what ways can we encourage communities of color, the communities that you're working with, to receive the vaccine? And what have you seen that has already worked to get those in your communities vaccinated?
Okay, let us figure it out on the back end, Ms. Davis, if you want to
Sure.
move on.
I'm going to move on to another question. So, Mr. Estrada, I do have another question for you. So knowing that there are needs out there, so many people lost their jobs and those types of things, or they were never connected to healthcare. So tell me, what are some of the resources that are available that you found out that you were able to pass on to community members? What resources, whether it's medical, mental, financial, what kinds of resources were you able to tell individuals about?
So pretty much all of above, every single subject that you have touched on has been available. Nothing was newly created per se. The problem is, once again, going back to people not knowing the right place to find the information. And for example, in my community, the language barrier. So again, a lot of those applications were in English, and we're talking about people that barely speak enough English just to be able to get by. And then when you're asking for them to fill out a government style application that has a lot of detailed information, it's nearly impossible for them to fill up an application. So again, the resources are there, the healthcare is there, the assistance with housing, the assistance with utilities, all of that is already there. It's just getting people to the right place at the right moment. So again, that's what we saw. The lack of the bridge, and again, going back to the same simple concept that sometimes people just don't seem to be able to understand or fathom the fact that, hey, I'm here, I'm supposed to get here. How do I make that? How can I get there? So again, the simple fact of thankfully our governments were able to be able to provide all of these resources, millions of dollars that went out there, and people were able to reach out to and get this assistance that was much needed.
Thank you so very much. And I hope that at this point, those resources are still out there, because although we want to get back to normal, COVID is still out there. There are still individuals that are dying of this. And so we have to be and make sure that we're taking care of our communities. So I'm going to actually ask Dr. Wiltz another question. I know he wanted to give us that breakdown. If you can do that for us, Dr. Wiltz, while we're waiting on Chief Warhorse.
Yeah, let me just first say that I know Dr. Griggs is going to bring this up, and he mentioned it before. There is no vaccine right now for children 5 and under. So, and we'll have a conversation on, I think, what we would recommend to try to protect that group. But from those 5 to 11, the Pfizer vaccine is available. You get 2 primary doses, 3-week support. the vernacular that people are using now, and you were asking about boosters earlier, is fully vaccinated versus up to date. There's the language we're using now. So to be fully vaccinated for the 5 to 11-year-old, you have to have received both primary doses, 3 weeks apart, and 2 weeks after the final dose in that primary series, you're considered fully vaccinated. There is no recommended booster for that age group right now. Continuing with Pfizer, they also have it available for 12, and they're authorized for that age group, 5 to 11, like I mentioned earlier, then 12 and older, 2 doses again, 3 weeks apart, considered fully vaccinated if you've had both doses 2 weeks after the final dose in that primary series. There is a recommended a booster dose 5 months after the initial dose in the primary series. And as I said before, the recommendation on adults 50 and over can get that receive a second booster dose. It's not mandated, but it is recommended, particularly for those that have more comorbidities, and that can be considered up to date if they got that. In the Moderna is approved for 18 and above. It's 2 doses, 4 to 8 weeks apart. You're fully vaccinated 2 weeks after the final dose in the primary series. And the booster is recommended at least 5 months after the final dose in that primary series. Adults 50 and above, again, or can choose to receive a second booster, and that would consider them being up to date. Johnson & Johnson, as we all know, has a 1 dose, and it's approved for 18 and above. And it's a 1 dose. You're considered fully vaccinated after 2 weeks after that first dose. The booster dose is recommended 2 months after that first dose, and you can get either Pfizer or Moderna. And anyone who received that first dose and the booster may receive a second booster 4 months after that. And that's the recommendations right now. There are lots of incentives you mentioned earlier, and I think you sent something out to the association. There's still monies available for the $200, I think, gift card for people and everything, right. Every technique, everything we can try. We're still, as a first line, we are, still pushing vaccines any way we can, because that is the most effective prevention that we have at this moment. And a little bit later, I'll talk about some other things I think that we can be doing.
Thank you so very much. And I'm glad you mentioned the incentives. Want to make sure that those that are part of this webinar and even our panelists, yes, just yesterday, we sent out information for Medicaid. If you're a Medicaid patient and you're receiving your first or second shot, you are eligible, potentially eligible to receive a $200 gift card. But I also want to plug the Louisiana Primary Care Association. We are working with the Mississippi Primary Care Association and Arkansas Primary Care Association, and we are also offering gift cards. And it's to anyone. You don't have to have Medicaid. You can not have insurance. You can have Medicare. We're offering gift cards if you're getting any one of the shots, whether it's the first shot, the third, or the fourth. And these gift cards are $50. You just have to receive your shots at an FQHC. So I'm excited about that for our communities. We still have incentives for them. And I'm going to try once again, Chief Warhorse, because I want to hear your comments, and I know everyone else does also. So if you can try and put yourself on, take it off mute, and if you can answer the question, and I can repeat the question also.
Okay. Well, finally,
yes.
Finally I'm in. Okay. I heard the whole thing. This is a dynamic panel, okay? And I'm gonna briefly cover what you asked earlier, but sure. I don't think I need to reintroduce myself or any of that thing.
We definitely read your bio. They know about you. They know you have
right.
a show.
So we ain't even gonna go to that part, but it's 3 things I do want to jump in quick and say in the place of that. Dr. Eric, what you said go for me too. Them grandparents and community groomed us, okay? And that's where culture come in, okay? When people hear the word culture, we have to include culture, because culture come with some foundations to it that we bring into adulthood and into our workplaces and leadership. Thank you, Dr. Greg. I would like, Eric, I would like to get with you one day on some of the topics you was talking on. Then you touched on Arkansas, Mississippi, Louisiana. That is my baby, okay? I work those 3 states, and those 3 states need to work together, even though we in different regions. We are families cross the line of Louisiana, Mississippi, and Arkansas. And sometimes we got to look at Texas too, guys, because that's also a state that our people leave and evacuate to when there are hurricanes. And my main thing I want to talk about is, here we come again. You know, this is me every year, have been for the longest. Here it is, hurricane season, doctor. And I would like you doctors to listen to one thing with me. Last year, our number escalated in Louisiana and also in the places where people went. Not saying we took it there, not saying we the one brought it back, but we saw number heights as people evacuated. My concern, y'all see CPRN, I'm concerned about the community being prepared. I like to act and not react, okay? Reacting takes 10 times more energy than being prepared. So right now, I'm working on things with Louisiana, Mississippi, and Arkansas with some great people. And one of the persons called me before I came on air. And I've been here from the beginning. I was like the first person in, y'all just couldn't see me or hear me. Elizabeth Teague said, we are all her good friend. And she calls me, I'm 62-year-old now, but she still think I'm a baby, okay? She says, you're a baby with this. I started out with Avery Alexander years ago, fighting to secure healthcare. The honor was seeing a part of Charity Hospital named after a trailblazer that talked about minority health. So I am a student of Avery Alexander, and I didn't want to leave here and not leave the name of the man who fought for us to have these hospitals and affordable health care and minority health. Now to the pandemic. As an American Indian, my culture taught me to cover up. And if my people, all I had to do is tell my people, you're under a mandate of a mask, okay? So we got to go back to cultures when the old people speak, somebody listen. I came out of an environment, if the old people say cover up, you was covering up. You listen more to culturally your elderly community, and we done broke that trend. And we need to try to get people back into a chain of command of cultural leadership. Because historically in community of color, you call the preacher, or you call the elders of the community, and you say, this is what need to be done. And they was the law enforcement. A mandate by the government does not work like a mandate by someone who have authority over your behind, okay? We were never old enough to say no to old people. Well, what we have to do is bring back some cultural respect. And this is the way I work. I may be a little arrogant to some folks. No, I'm being demanding for their life safety. I do not force anyone to take shot, not take shot, because I also taught in civil rights through these communities for years. Peer pressure make drug addicts. I don't want to teach people to be peer pressured into making decisions for their lives. So we contradict ourselves sometimes when we put mandates more than educate. Less information, give me less material to make my decision with. Misinformation make me make a bad decision. So I play mediator a lot of times so people get the right information. I'm against what I'm hearing in the press now about don't wear your mask. I believe the masks have brought us where we're at. I believe to listen to what CDC says. I believe in it enough to be on the senior advisory board. I cannot let politics dictate my health when we done sent people like Dr. Eric and Dr. Gary up there. These people are doctors. And if we're not gonna listen to the doctor, we're gonna listen to politics. I think politics, what I saw on my end in these 3 states, politics made people don't want to wear the mask, wear the mask, take the shot, don't want to take a shot. That should not have been a part of a medical decision. The medical decision should have been based off safety for everyone. In my tribe, we still wearing masks, okay? And we're gonna continue to wear a mask. My daughter lived out of country working. We discussed this. She's gonna still wear a mask when she fly home. for her safety, our safety, and who's on the plane. We're going to have to start playing politics with our lives. Then when things don't go right, we are mad with the government. We are mad with CDC. We got to play more of a part of being a partnership to get proper information so we make the proper decision. I don't care if you Democrat, Republican, or Independent. COVID was taking you out. I don't care if you were black, white, female, gay, whatever, straight. It was taking you out, young and old. That is a serious issue. First of all, I'm still hearing people say, I don't believe COVID was real. Okay? Yeah. That's crazy. Why we got so many dead people in our family. I do think they overplayed politics. I do think we need to give the control back to the medical people to help us make a proper decision. And that's why I'm a part of pardoning. So I get the proper information to bring to people. Just like I heard you say about the updating their medical stuff with the state. That's a regular thing here. We have to put together organizational trainings for leaders. Now, I'm not trying to be rude, but we have a lot of people leading and don't know how to lead. And if the blind lead the blind, they both fall in the ditch. Can I do it that way? Not politics.
You can.
Blind leadership. Okay?
Yes.
And then we got too much being politically correct. I haven't learned that yet in 62 years. Okay? Politically correct means you're going to go with what's going to be pleasing to everybody. I'm not politically correct. I'm just going to be factual. Doctors have put their lives on the line. I'm with you, Dr. Eric. I don't know what kind of degree I done earned with reading, but everybody in my areas that I work with think Chief Warhorse know everything, including the state. Ask Chief Warhorse. So that throw Chief Warhorse to read and study a lot. Something else we have not brought up on this panel to go along with hurricanes and COVID. We have the bird flu out there. Okay? That plays another level and put another layer on top of stuff. So we're dealing with a 3-level issue here, not counting the economy issues and the gas hike. That puts stress on people. So if they do have COVID, doctors, I'm not a doctor, but I done read enough stuff like y'all. I think I'm one. I believe in herbal healing, but I also believe in doctors. And even those who are Christians, the Bible say you're either going to be healed by faith or go through the physician. So if you know your faith ain't strong, you better go find your doctor. That's my advice. So what I'm saying is, doctors, what could we do out of this panel today to secure the numbers not going up in the states we were talking about? Because I evacuates to Arkansas. Right now I'm in my mobile office. I start on March 1st, getting my communities ready for June 1st. A lot of times there are storms that hit between that starting up in March that I start and June. I do workshops. I would like to get you all to come on Cooking with Chief, if y'all don't mind, and serving up a little history. Medically, we done been down pandemic road, historically. One of the key things is washing your hands. We got to make people understand, don't stop that when you take your mask off. The next thing is—
Chief Warhorse, I'm just going to stop you right there. I'm coming back to you because I believe that the information you are giving is very relevant. I want individuals to realize that there are some things that are relevant for all communities, and then there's some, as you're saying, you tweak for the community that you're serving. Just as Mr. Estrada, just as Dr. Wiltz, just as Dr. Griggs. Right. I do go though to Dr. Griggs right now because I do have a question. If you've already had COVID, should you still get vaccinated? Dr. Griggs.
1000%. The answer is yes. What people are talking about is natural immunity versus vaccine immunity. Natural immunity will not protect you from COVID. We know that. We've seen it. Dr. Wiltz, I'm sure you know people that have caught— I know someone that's caught COVID every year that the virus has been around. It's not funny at all, but they are big, huge proponents. After the second time, they finally got vaccinated. The vaccine works. It was made specifically for that reason. It's science. We've been given the gift of science. We've actually been given the gift to have something that can actually pull us out of this if we all get on the same page. So that's my answer. Yes.
Thank you.
The Chief Warhorse's, to her point though, talking about the elderlies, all of us remember our grandparents saying an ounce of prevention is what? Worth a pound of cure. So, and to her point about mask wearing, and Dr. Griggs, you can attest to this, that this is these last few years that people have been wearing masks. We've had the lowest incidence of flu outbreaks than we've ever had. If you go back 100 years ago, when the great flu epidemic, what did they have? Masks. They wore masks. You know, so I mean, if you fail to be a student of history, you will repeat it. And
Which
that's
we do every year. We've been doing it every year, Doc. Every year we get out, we party, we make the roaring 20s, and here we are again.
Yeah, and then, you know, one of the worst things, I wanted to bring it up because to Chief Warhorse's point, one of the greatest tragedies of this whole pandemic, and it was discriminatory, was that we had available and the government had purchased monoclonal antibodies to treat people that were infected. And when folks went to the emergency room and got tested, to borrow a phrase from Clinton, it used to be, don't ask, don't tell. If you didn't ask, you were not told. And thousands of people died in this country, particularly minority patients, because they were not told about monoclonal antibodies and they did not receive that early treatment. We're not going to make that mistake again. Tonight, I know the points that we're making about vaccination information, but there is treatment available. And if you don't leave with anything else tonight, there are antiviral, particularly the one that Pfizer makes, the Paxlovid, that's available. It's an oral treatment. If you have symptoms within the first 5 days and you get diagnosed and you're high risk, it's 30 pills. You take them, 3 pills twice a day for 5 days. It's sort of like Tamiflu, but you got to get it done early. And there's some criteria. You got to be 12 years, at least 8 pounds, and be considered high risk. Everybody in Louisiana has elevated BMI. So right off the bat, they almost all qualify for it. But once again, the government is paid for it and it is free.
Yes.
But if you don't know it, then you'll never get it. So we've got to communicate, educate of getting tested, vaccinated, and then treated. It's a gift. 89% of the people that get treated do not progress to hospitalization and death. I mean, it's a tremendous resource that's out there that we are not, I don't think we put it out there enough to make sure the public understands that and knows that that's available.
And I thank you so very much. I thank Chief Warhorse for her comments. Dr. Griggs, I thank you, and Dr. Wiltz, because it's so true. So true. And I know from our perspective in the clinics that we work with, how we've been trying to get that word out to make sure that people know. Because of, and I was so grateful that the government did do, and science actually, where not only were you able to get them from hospitals, but then they changed and flipped the script, because people were turned around or turned away from hospitals. I remember contacting the Louisiana Department of Health and notifying them when I heard stories of people being turned away from hospitals and telling them that they didn't qualify and those types of things. And then it was made available in some spots that were outside of hospitals, and I was very grateful. So thank you so very much. And Mr. Estrada, I do have a question. I have some questions, a question for each of you, and then I have a final question for everyone. So Mr. Estrada, one of the questions I have for you though is, okay, so you've gotten over 2,000 people that have been vaccinated in your community that you're working with. So how are you going about helping them to encourage their family and their friends to get vaccinated?
So that, again, was a learning experience for us, because at the end of the day, whenever we first started, we were not professionals in COVID. We literally were just trying to, again, be the leaders in our community, trying to provide a service, but we really didn't know what the service entitled to, like it's just, we pretty much just learned as we went. So what we encourage people obviously was to get the proper information. We created information for them in Spanish, and we simply allow for them to provide that one-on-one information to their family and friends. For example, for us, again, creating those videos and being able to be of service to them as much as they needed, because it's a lot different whenever you get the information from somebody that you know and trust. And just like Chief Warhorse said, simply that elder in the community. Unfortunately for us, the elders in my community were saying, look, no, I don't want this because I don't understand it. So that meant there were 100 people behind them that said, look, if they are not up for it, I'm not for it. So once we started to change that behavior within the community and creating that trust, that this was free, that there was no cost associated with it, that no one was checking you out, no one was coming to your house, no one was. So again, so much misinformation that was attached to the vaccine, that was nothing more than urban rumors. We were able to simply create that proper information service, and then people themselves took that to their friends and saying, hey, this is what I was able to pick out. I think you should do this because of this. So now when you have people becoming leaders of their own little sectors, now you have that important buy-in. So again, I think that was primarily important for us to be able to get people to buy into it and understand that I'm not trying to sell you anything. I'm trying for you to be healthy, to continue to be here, because it's important for you and for your family to protect yourself. Just like the test kits, they were free. And you would be surprised how many events we worked that we were literally trying to give them away, and people would look at us and say, I don't want that. This is nothing more for you to continue to have a way to protect yourself. If you feel sick, check it out. If it comes positive, then go to a doctor that can actually provide you a proper test. This is nothing more than a 50-50, but even a 50-50 is better than a 0, in my opinion. But for them, it was one of those things that, what is this? How do I use it? So now I had to explain to them the proper way of using a kit, why you want a kit. Again, everything is free, but to them, or to the community that I was representing in assisting, it was an unknown. The fear of the unknown kept them away from it.
Thank you so very much. And it's so important, as you've said, Chief Warhorse, Dr. Wiltz and Dr. Griggs, it's important to have our elderly champions, to have just community champions, those that give great information. And sometimes it's a matter of, educating our elderly. And so then once they have that information, and they then become the champions, because I too believe in that. I was raised back in the day where it was all respect, and it still is very much so respect for our elderly. They know what we don't know, and we need to sit at their feet and to learn from them. It's also important to tell our communities about the fact that all of this is free. I was on a call last week with some people from the federal government, and they were saying that if we had heard of any individuals that are being or trying to be charged for certain things, then that is not what's supposed to happen, because the government has basically purchased these things. They've purchased the vaccines, they've purchased the tests, they've purchased these things to be able to give to the public for free. Sure, healthcare providers can charge Medicaid and Medicare or private insurance, but in no way should they be charging patients. Patients should be able to walk up, get that vaccine for free, get the test for free. And so I just wanted to stress that. I do have another question for Chief Warhorse, and then I'll have one for Dr. Griggs and Dr. Wiltz, and then we will go to our final questions for you all. But one of my questions to you, Chief Warhorse, is hold on, I'm sorry. So hearing you talk about the numbers and how when you evacuated, not saying that individuals brought the COVID to where they evacuated to and those types of things, tell me, what are some of the ways you are working with your community to ensure that if they do have to evacuate, because hurricane season will be around, and we don't even need hurricane season. We've had tornado season lately. When they have to evacuate, when they have to go to a hotel or live with someone else for a certain period of time, what are tell me 5 steps that you're telling them they need to do? Whether it's, tell your daughter when she comes, she has to wear a mask. What are some of the other things that you're telling them that they need to do as they prepare? You say you are proactive, you're not reactive. We know hurricane season is happening. What are you telling them to do? You have to take your phone off of mute again, or your computer.
Okay, first thing, preparedness is an all year thing, it's a lifestyle. When you don't start creating it to be a lifestyle, it becomes very expensive at the last moment. Everyone should be knowing where they're evacuating to. That's number one. It's bad to leave home and don't know where you're going. So one, they need to find out where they are going. If they are going to a family member's home, they should make arrangement with them where if they have another place or a smaller college or something that they can stay in, that will be first thing. The next thing is, if you're going to these people, still wear your mask, is what I'm telling my people. And let them be prepared to wear their mask. And when you remove yourself from the environment, if you have to eat or whatever, try to find, it's summertime, try to eat outdoors and not have family meetings in and food eating indoors. Do more outdoor stuff, giving each other space. On top of that, hotels don't become a good place to evacuate because different people are coming from different places. It's not a controlled environment. So you should be evacuating more to a controlled environment. Okay. If you have a camper or a mobile home, you should be making reservations to go to a near campground or state campgrounds or national campgrounds and get in a space zone. You're having to govern your space. So if you get there, you try to park at least 6, 10 or more feet away from the next person. Those are some safeties. Try to gas up and fill your tank so you have to stop at stores and make contact less from getting from point A to point B. Then the next thing is, do not evacuate thinking that you had the shot and they had a shot and you're safe. The doctors just said you're still vulnerable to catch and pass. So I'm telling my people the shot is not a one-stop fix. The shot is a point of safety level, 1 point. The main point is less contact, you are more safe. So when evacuating, use your gloves when you're at the gas pump because more people are pumping gas up ahead of you. So, I tell them to have this preparedness kit in their car. If you have to stop and use the restroom, you need seat covers so that when you go to the bathroom, you have a seat cover and a bathroom sanitizing kit, a nice little kit. I'll get one together and send to you, okay? Have this little kit that you keep in your car. This is your evacuation bathroom gas station stop kit. All right, it should be in your car. Take food with you so you don't have to stop along the way, stopping to eat because you can be contaminated or contaminate someone. All right, we go through those steps. And if you don't have to leave or you can't leave, you still need a safety lock-in plan. It's a stay and go plan with me. So if you stay in home, you need also a safety plan because and they don't, we got to walk sometime people through this, like the gentleman just said, help teach our elders so that they can become a part of the advocate list. Senior citizens are not working, a lot of them. So they are home. So they get to do some things while everybody else is at work. They get to help people get their preparedness together, get their food together, tell them the necessities they need. So the seniors are important. I do a youth program to have the children prepared. Now the doctors know I'm telling the truth on this one. If the kids just ripped up, don't know where they are going, we already the adults who they look to, they see us getting paranoid. Now we done broke the system down for the kids. So when the kids get nervous and sick, they more vulnerable to get infected. Am I right, doctor? Get your body down. No, we got to keep our health up. So I'm gonna close with this one, doctor. I need to ask a question. How do we on this panel get people to understand the importance of the hurricane season, pandemic, and the flu as a team, doctor and community leaders? I listen to the gentleman with the Hispanic community, Latino community. I work with them too. I understand the language difference, but the life is the same thing. What would you do as doctors if we would bring you to, if this gentleman and I bring you to a community and say, look, we need you to help us get the medical part to go with what we're doing? What would y'all suggestions be? I'm asking this because people ask this all the time. What would you doctors do? Take the politics out.
I'm only going to say we have 30 seconds for each one.
Well, I think you covered most of it, but one important thing is to make sure you bring your medications and you have enough medications.
There you go.
Because state law allows pharmacists to fill them without a prescription. They'll give you a 30-day supply. So
that's right.
That would
Some
be one.
Some places give you 90. Some give you 90.
Thank you.
That's right. So that's one thing.
Thank you, Dr. Griggs.
So one of the first things that you need to do is acknowledge the fact connect with the audience and realize that you have a lot packed in that little question. We're all living in a state of fear right now. We're living in our fight or flight response. There are two hormones that govern the fight or flight response. It's called cortisol and epinephrine. It's fight or flight. Cortisol is, I call it our deer in headlights or our stupid hormone. We don't hear anything. When you go to the doctor, you hear bad news. They tell you this big, long diatribe of things that are wrong, and you don't remember any of it. So the first thing you need to do is connect with your audience. Be like, listen, we're all afraid. I'm afraid with you. But take a deep breath. We're going to get through this. What questions do you have? And then I'll tell you what I have. So acknowledge that your audience, that you connect with your audience, and then give it to them in small bites. And don't leave until you've answered every question.
Thank you so very much. I have two more questions that I want Dr. Wiltz and Dr. Griggs, if you can do it in a minute, and then I have a final question. So one of my questions, because I think this is important, why is recognizing fit physician, and this is Dr. Griggs, physician bias is critical during a crisis? Because as the hospitals and turning away. Go ahead, Dr. Griggs.
Because as we have seen, even prior to COVID, physician bias kills. It's been around for a long time. I won't name the name of the doctor that they take a lot of it to with regards to African Americans, but it did happen in the South. And there are a lot of misconceptions. Before there was COVID, there was sickle cell, assuming that the Black people were drug seeking when they were actually going through a pain crisis. Biases, misinformation, all of that can kill. Physicians on this side of the table need as much training as the community on cultural competency to dismiss the myths and disinformation that they've been given.
Thank you. Thank you. Dr. Wiltz. Okay, I got to give you a minute, Dr. Wiltz, a minute or less, but I know this is dear and near to your heart. So what were some of the factors that contributed to why communities of color experience an increased number of cases and adverse effects of COVID-19?
Well, as I previously stated, we were set up because of pre-existing conditions and misinformation, I think, were the two contributing factors. As I said early on, folks were saying that Black folks don't get the virus, which was ludicrous. And then, you know, not being in the greatest state of health, I think put us at pre-existing. And to Chief Warhorse, another huge, when someone got diagnosed and did the patient tracer and you were told to go home and quarantine, if you attend in a household in a 1-bedroom house, how are you going to isolate, you know? So it was just set up for failure on so many levels that we just did not prepare and then, do the things that could have mitigated a lot of those circumstances.
Thank you so very much. So my final question is to each of you, and I'll start with Mr. Estrada. As we close, what is one thing you want our audience to take away from this webinar?
I think that regardless of the negative impact that COVID has had on the entire community and world, we're still here. So there's a reason, there's a purpose, and we need to find the better solution, not only for me, for you, but for everybody within the community. So I think working together, we could definitely get past it and get to normal, whatever normal might be. Again, COVID is already here. It doesn't seem to be going away. It just seems that we are getting better while working with COVID. So I think the positive is we continue to be here. We are happy and we're just happy to be alive.
Thank you. Dr. Griggs. You're on mute. Unmute.
Well, the first thing is that we need to unmute the microphone when you're on a panel. Remember that. The big thing, though, is just like Mr. Estrada just said, is acknowledge the fact that we're still here. We're not going anywhere. And we've done so by being consistent in this fight. One thing I want us to remember in Louisiana, it was our governor that was the first in the country to acknowledge the fact that 7 out of 10 bodies that showed up in the morgue looked just like us. All of a sudden, that mis and disinformation, it disappeared. And as a consequence of him saying that, we answered. And not only did we were number 3 in the world at the time. Not only did we flatten the curve, we flattened it almost to a flat line. We showed the rest of the world that if you tell us the truth and you're just transparent with us, we will respond. So remember, the answer for the community is in the community, and it's us that following the lead of our leadership that can continue to get us through this.
Y'all got me about to shout right now. Estrada, Dr. Griggs. So, Chief Warhorse, your comment, final words.
Well, first, it's an honor to be with all these intelligent people on COVID, because sometimes you feel like you're the only one in the world trying to find out anything. So it's an honor to be with you guys. My final word is this: let's get prepared. As a people in communities, no matter what religion, color, or whatever, let's get with our doctors and get the right information. I think information have been the problem. Well, let me do this, the misinformation. And watch what we're dealing with on social media that's being pushed at us. Turn to our local state leaders in the medical field. I salute you guys who've been out there on the front. I have a daughter working in the medical field too. And I was very much worried about her throughout whole COVID because she stayed in there. Okay. So I thank you guys. That's about all I can say. You put your life on the line for us. Y'all the first responders.
Thank you. And Dr. Wiltz.
I'm going to end with what I began with. With every new patient, I tell them the prayer. We recited together the prayer of serenity. You know, and when you boil it down to its basic tenet, you can control what you can control. You can't control your age, race, sex, and some of the external environments, but do everything in your power to try to mitigate, prevent, and protect yourself and your family. And that gives you a peace that Pablo talked about, and I think Chief Warhorse and Dr. Griggs, that you when you are active part of the solution and not part of the problem, that gives you a comfort and confidence level that you can get some serenity and some peace.
Thank you so very much. And I do want to say, and I heard the comments, and Dr. Wiltz and Deputy Secretary Thomas were saying earlier, and Dr. Griggs, it is so very important. Community health is so important, and public health. And I am tired of them being disrespected. They need to be respected, because that is how we take care of the public and the populations out there. So thank you so very much, LDH, and I'll turn it back over to you.
Wonderful. Thank you all so much. Let's see, as we get our PowerPoint back up onto the screen. Let's see. Wonderful. All right. Yes. So thank you, Ms. Davis, Dr. Griggs, Chief Warhorse, Dr. Wiltz, and Mr. Estrada for all that you've had to say today, for your responses, and for being a part of this especially important panel discussion. As community gatekeepers and medical providers participating in this discussion, each of you has helped to enrich people, populations, and communities' awareness. So thank you again. So now we'll go over these key takeaways that we discussed are 4 COVID facts. So again, information, be sure to get up-to-date and accurate information from credible sources related to COVID-19. Vaccination, LDH and the CDC recommend that everyone in Louisiana 5 and older is eligible to get vaccinated against COVID-19. Prevention, masking up, especially in enclosed, crowded spaces, social distancing when we're able to, and washing hands thoroughly can protect us from the COVID-19 virus. And last but not least, COVID vaccines are safe and effective. Next slide. And most importantly, I want to thank all of our attendees for coming and listening to this discussion. And I hope that you found something enriching and valuable that you can take back and add to your discussions with your families and within your communities. Please utilize the resources that we will be emailing to you all after today's presentation, including the recording of this webinar and our one-pager, which outlines the facts regarding COVID-19, how to get and share trustworthy COVID-19 information, where to get resources that are available within the state. And once more, for those of you who may have Medicaid insurance, if your medical insurance coverage is from Medicaid, then you must make sure that your information is up to date. This includes your address. If you do not update your information, you may miss important letters from Medicaid and you could lose your health insurance coverage. To update your information, you can visit the self-service portal at www.ldh.la.gov/my Medicaid, or you can call 1-888 342-6207. At this time, I will bring in the Director of the Bureau of Community Partnerships and Health Equity to close out our webinar. Devonja.
Thank you, Ayanna. Before we go, I'd like to thank the staff of the Bureau of Community Partnerships and Health Equity and the Bureau of Minority Health Access for executing such a needed conversation. A huge thanks goes to the entire Louisiana Department of Health team. And last, but certainly not least, a special thank you to the Secretary of LDH, Dr. Courtney M. Phillips, for her continued leadership in pursuing a healthier Louisiana. Please join us for our next conversation focusing on sexual and gender diverse health on June 22nd at 5 p.m. This will conclude our event tonight. Thank you all and have a good evening.